Welcome to Bridle Trails State Park. I'm Heather Andrini.
And I'm Mary Desher.
And I'm Candace Boyd. Welcome to the Bridle Trails Park Foundation's video series all about equines.
We hope this will be a fun and interesting way to learn the basics of horse care and safety.
And to learn all the different things that horses do.
Feel free to follow us on social at bridletrails.org.
We really hope you enjoy the videos as much as we enjoyed making them.
And we look forward to seeing you in the park.
Hi again, I'm Heather Andrini, and this is Eros. He's a 12-year-old Frisian. Part of keeping horses is going to be veterinary care. In a perfect world, you'd only have to have your vet out once a year to do vitals and dental. So we have Dr. Dana here today with Professional Equine, and she's doing Eros's annual exam. She's going to check his vitals, his temperature, his heart rate, his body condition, and in addition, she's going to check his teeth to see if he needs what we call a dental float. We will show you what a dental float is in this video, and also you will see her giving him his vaccinations. Now we have Zeus, and Dr. Dana is going to check his vital signs, and Dana's going to tell you what normal range for horse vitals is going to be. Sorry.
So we just took his temperature, and normal range on a rectal temperature on a horse is between 99 and 101. Anything above 102 is a fever in a horse. His heart rate was 38, which is low and good. The higher heart rates above 60 tell you that the horse has pain somewhere. It's abnormal. And then respiratory rate, his respiratory rate is 14. Anything above 30 is high and could be a sign of a respiratory infection.
So Zeus is going to have his teeth floated. That is what we call dental work for the horse. The term comes from floating concrete, where you make it level. So what Dr. Dana is going to do is she's going to file down any sharp points on Zeus's teeth. Just like our nails, the horse's teeth continue to grow, and any sharp points have to be filed down so they don't cut their mouth and cause them pain when they're eating. So now Zeus is having his teeth checked for any sharp points that would inhibit him being able to chew his hay. We do not recommend that you ever put your hands in your horse's mouth. Please leave that to your veterinarian. So in order to have his teeth float, Dr. Dana is going to give Eros a sedation. So Dr. Dana is washing out his mouth prior to his dental work. So another thing a horse owner wants to be cognizant of is the weight of their horse to make sure they're not getting too chunky or too thin. So one way to measure the weight of your horse, if you don't have a commercial scale available, is to use a weight tape. Dr. Dana is taking Zeus's measurements and will be able to approximate what he weighs by the weight tape. So the weight tape says he weighs about 1,079 pounds. And the weight tape goes around him as you saw, and then has little indicators for the weight. The other thing the tape will measure is the height of the horse. A horse is measured in hands, which a hand is 4 inches. Back in the day, they just used to measure the horses using their hands, and that's still what we use today. So you measure the horse to the top of their withers, and Zeus is 16 2 hands times 4 inches will give you his height.
Okay, horses in Washington get vaccinated for flu rhino, which is a respiratory disease, West Nile virus, which is transmitted by mosquitoes, tetanus, because they can get tetanus from a contamination into a wound from the soil, rabies, to protect them from rabies, which is transmitted by bites from rabid animals like bats and skunks, and then some barns require a strangles vaccine. Those are the core vaccines.
So now Dr. Dana is giving Eros his annual injections. Vaccinations are required in the state of Washington, especially if you're going to show your horse or travel at all with your horse. This will keep him healthy for the entire year. So this is Galahad. He is also a Frisian. He's 10 years old, and part of a requirement of the Frisian breed is that they be microchipped. So when they're having their vet exam, the vet has a special wand that she will use and scan their neck, and the microchip will get read and will show her their registration. One of the main reasons for microchipping your horse is to prove ownership. These black horses, as you've been able to see over these past few videos, all look very similar. So the best way to prove that this is your horse is by scanning the microchip. Many of you may have that with your dogs and cats as well, and it's no different and can prove ownership if they get lost or stolen.